Bismillahirrahmanirrahim. My name is Dr. Ataul Ahmad Zai. I am resident of ophthalmology department in National Medical University and Hospital Multan. My research topic is comparative study of intravitreal bevacizumab and intravitreal diclofenac in the treatment of diabetic macular edema. First, introductions. Diabetic retinopathy, which is the complication of diabetes. It is the major cause of visual loss in the working age population, which is 40 plus. 34% of people who has diabetic retinopathy, they are 40 years old and they are 93 million pupils. Diabetic macular edema, which is the complication of diabetic retinopathy, it is a fluid pulled up into the neural retina, into the macular regions. The risk of raising diabetic macular edema is associated with extended duration and raised HbA1c. It means that the risk of diabetic macular edema is directly proportional to the duration and poor control of diabetes. Treatment of diabetes and also with poor control diabetes, which is raised HbA1c. Treatment option for diabetic macular edema is anti-VEGF, which is a well-known agent. What is anti-VEGF? Anti-VEGF is anti-vascular endothelial growth factor, which is a humanized monoclonal antibodies. It targeting the vascular endothelial growth factor, which is present on the vessels. It has vascular endothelial growth factor, which has a critical role in the pathogenesis of diabetic macular edema. This group has multiple types, we are injecting routinely in our department, that is bevacizumab by the name of Avastin and also ranibizumab by the name of Patisiran. We are injecting every month intravitreally in the treatment for the treatment of diabetic retinopathy and also for the treatment of diabetic macular edema. But it is very costly medicine. It has more cost. It is not available everywhere. So another treatment option is intravitreal steroid, like betamethasone, where it has also cheap, cost effective, but it has side effect like raised intraocular pressure and also it will progress the cataract. So for this reason, we have to provide a medicine which is cost effective and also effective like anti-VEGF. So for that reason, we have select NSAID, non-steroidal anti-inflammatory drug. As you know, non-steroidal anti-inflammatory drug, it inhibits the production of prostaglandin and leukotriene and have grown as a new treatment modality in the treatment of diabetic macular edema. From this NSAID group, we have selected diclofenac sodium. Diclofenac has two forms, potassium and sodium. We are using diclofenac sodium. Diclofenac sodium, it inhibits cyclooxygenase and lipoxygenase pathway, making it as effective as corticosteroid with additional benefit of not raising intraocular pressure. It will not produce glaucoma. So, and also it will not produce cataract. With of not having unwanted side effects like cataract formation and raised IOP. So it is a good modality for the treatment of diabetic macular edema. In the literature review, several studies stated that prolonged effect of intravitreal diclofenac and also topical diclofenac, they have shown that it has effect in the treatment of diabetic macular edema, intravitreal diclofenac. But if we want a good, visually good response, we have to repeat these injections. Anti-VEGF like intravitreal bevacizumab, Avastin. It is a well-known agent. We are repeating that medicine every month intravitreally, so the patient will improve. At least we are injecting 3 or 4 injections, so the patient are developing good visions. So at the same, you have to repeat this injection intravitreal diclofenac, so the patient will develop visions. By one injection, there will be no good response. There is one study that has been done in Iran, Tehran, in 2017. It has confirmed the helpful use of intravitreal diclofenac comparison to corticosteroid on diabetic macular edema. With diabetes, it has improved the diabetic macular edema and vision, and also it has decreased the macular thickness changes, which we have to be seen on OCT. NSAID reduced IOP treated patients. Intravitreal diclofenac has been also, they have proved that it is also good for the refractory diabetic macular edema. What is the rationale for this study? Why I am doing this study? If you have a good rationale for a study, it means it is a strong study. No study has been done in our population, so it means it is a new study. I have to do it. The cost effectiveness of intravitreal diclofenac compared to intravitreal bevacizumab. You know, intravitreal diclofenac is very cheap medicines, and also its widespread availability of diclofenac. This is the another rationale for this study. Both factors play pivotal role in the patient's adherence to therapy. Which factors? Cost effectiveness and also widespread availability. It has a pivotal role in the management of diabetic macular edema, which if untreated, if we untreat or undertreat the patient of diabetic macular edema, he will lose the vision forever, which we don't want. For example, if a patient is in the periphery, there is not available this intravitreal bevacizumab, or if the patient has economically he cannot afford. So if we inject this medicine, which is intravitreal diclofenac, and we prevent from the vision loss, it is a good achievement for us. It will be. What is my objective? Objective is to compare the therapeutic response of intravitreal diclofenac versus intravitreal bevacizumab in the treatment of diabetic macular edema. In terms of functional improvement, as a functional improvement which is visual acuity as a primary objective, and also as a in the terms of structural improvement in the form of secondary objective. My primary objective is to improve my patient visual acuity, and also secondary objective is to improve the macular thickness, and structural improvement, which I have to be evaluate or assessed with OCT, which is ocular coherence tomography. That is a form of scan. Alternate hypothesis. What is hypothesis? Alternate hypothesis. Intravitreal bevacizumab is more effective than intravitreal diclofenac in the treatment of diabetic macular edema. This is my hypothesis. For the rejection of this hypothesis, I have given the null hypothesis. There is no difference in intravitreal bevacizumab and intravitreal diclofenac in the treatment of diabetic macular edema. So this is my hypothesis. Material and methods. These studies I will do in the National Hospital Ophthalmology Department. The duration of this study will be 12 months. Study design will be quasi-experimental, and also sample size. My sample size will be 90 eyes from 45 patients, and sampling technique will be non-probability consecutive sampling. Inclusion criteria. Which patient I have to include in my study? A patient who has clinically significant macular edema, a patient who had mild NPDR, mild non-proliferative diabetic retinopathy, and a patient who has severe non-proliferative diabetic retinopathy. And also, which patient I have to exclude from my study. I will not include in my study a patient who had previous pan-retinal protocoagulations. For example, a patient who had disease of retinopathy, and he has lasers, diffuse laser on his retina. I will not include in my study. And also a patient who has raised intraocular pressure, I will not include in my study. And also a patient who had a good vision, for example, more than 612, I will not include in my study. I will think about another modalities. And also a patient who had worse vision than 6 or 60 or 660, I will not include in my study. Also, the patient who had proliferative diabetic retinopathy, which is very severe form, I will not include in my study. And also a patient who has significant media opacity, for example, if the patient has diabetic macular edema on the OCT, if there is a significant media opacity, patient has corneal opacity, patient has advanced form of cataract, I will not include in my study. And also if the patient has any kind of macular disease, I will not include in my study. This inclusion and exclusion criteria is based on the ETDRS. It means it is one of the study. ETDRS stands for Yearly Treatment of Diabetic Retinopathy Study. Data collection will be questionnaire, and data collection procedure will be grouping A and B, and data analysis method will be SPSS4 24 version, -24 version. I will use in my this study for statistical analysis. I have used a very recent and very authentic references in my study, which is from year 2018. You can see at the first, I have used from 2019, which is a recent, and also from 2021. These are all relevant study regarding intravitreal bevacizumab, intravitreal diclofenac, and also intravitreal steroid. And also I have used this study, which is done in 2015 in Saudi Arabia, and that has been published in 2018 in Saudi Journal of Ophthalmology. The title of this study is intravitreal diclofenac versus intravitreal bevacizumab in persistent diabetic macular edema. Anatomical and functional improvement. They have proved that intravitreal diclofenac is a good modality and has a good effects. And also one study has been done in Tehran in 2017. They have compared intravitreal bevacizumab and intravitreal diclofenac in the treatment of diabetic macular edema, and they have showed that intravitreal diclofenac is a good medicine. So now we are doing in our population. This is a new study, and it will prevent from the most visual loss in the patient who has who cannot afford, or the patient. It is so cost-effective medicines, intravitreal diclofenac. Thank you for your time and attention. Assalamu alaikum.